Today from Asthma Allergy Centers, Dr. Giri Dandamudi. Welcome back to the show.
Nice coming back, thank you.
Yeah, so we've talked about, a lot of times we talk about seasonal things, allergies, during allergy season. We talked about COVID. What do you think where are we with the pandemic?
I think we are getting end of that one.
Yeah.
So probably by end of the year probably will be.
This last round of the vaccines, which are reformulated, how important do you feel that is to get those?
I think this is good to get them this time. One more because we don't know for the winter how it goes. So if they get one more this year, probably next year, it will be okay.
All right, so get your vaccine. They're available right now. And I think in most cases, you got to get an appointment. Maybe a handful of places have walk-in. County Health Department has walk-in, so. Flu shot too.
Yes, flu shot and the COVID vaccine too, most important this fall.
Yep,
Yeah.
Get double protected. Well, today we want to talk about what's commonly called hives, but it's got a scientific name.
Urticaria.
I can't even say it. I'll go with hives.
Yeah, hives is fine.
What is urticaria?
See that in general, to make it very simple. Mm-hmm. So I explain the patients like this. You have a human body, then you have human organs, mm-hmm. and then we used to tell you have a kidney problem, liver problem, all those things. Then it is a cells. It's a cell problem, and you need the cells to fight an infection. Mm-hmm. So where are the infections? In the tissues, but the cells are inside the blood vessels. So they have to get out. To get out of the blood vessels, there are some chemicals we are released, which we call as the mediators, that causes the inflammation.
And it's a skin reaction.
No, it is a generalized reaction.
Really, it's not just the skin.
It's called as inflammation in general.
So you could have it somewhere where it's not visible on your skin?
No, hives are different.
Okay.
Hives are coming from inside out. It is not because of something on the top of the skin.
Okay, it's inside your skin.
Yeah.
And it shows up on your skin.
On your skin.
And it's like
hive. So if you take a hive, if you squeeze it, it will disappear. You leave it, it fills up the space in between the skin layers.
Is there a certain part of your body where you're most likely to develop hives?
Yeah. So the beginning of that is the inflammation. We already have inflammation. Yeah. So the question is, what is inflammation from? Is it from infections? Mm-hmm. Is it from allergies? Is it from cancers? Is it from autoimmunity? Is it from trauma? So you have to create an inflammation to heal, and some people overreact for that one.
So you brought a chart that shows, I think, immunology of these diseases.
Yes.
So
here I see the mast cell. So the mast cell is the most important cell. Those are the ones that stays where the exposed parts of the body, like your eyes, nose, lungs, skin, and gut. Mm-hmm. And they have all those mediators, the histamine and leukotrienes. And when they come out, they open up the blood vessels. If the blood vessels open up in the skin, we call them as a hives. Hives could be 1, 200, 2 million. Hives are hives. But there are acute hives. The important thing is what brings the chemicals out. That is the key. So that's why the hives are different types of hives. There are acute hives bring by usually food allergies. So a kid that has a peanut allergy, for example, and he is sensitized, he make that antibody, the IgE antibody. There is an antibody that is very specific for peanut proteins.
So someone with a peanut allergy develops hives in reaction to the allergy to peanuts.
Yes. So what happens when they put the peanut inside the mouth, there are mast cells in the mouth, they release all these chemicals into the bloodstream. And that's why you break out of the hives all over, and histamine causes itching. These are the early indication of acute allergic reaction, as presented as hives. But if the whole system is whole blood vessels are opened up, the blood volume goes down, and they get hypotension, like a bee sting, for example. People get a bee sting, all of a sudden the blood pressure drops. They have hives, they have respiratory problems. So this is called as acute hives, and most likely caused by either something you are ingesting or it could be injecting.
So acute in this case, acute is a one time as opposed to it's something that recurs.
Yes.
Right?
Yes. Acute, most of the time we can find a cause because they never last longer. It lasts maybe a few hours, but it's life threatening, and that's why most of the people with acute allergic reactions with the hives, we give a kit, EpiPen kit, where they use the epinephrine. We give the kit. When they inject that one, it shrinks the blood vessels. Basically, it closes the loops so that the fluid doesn't get away. So those are most common, that acute hives caused by the food allergies, drug allergies, and occasionally it is insect sting allergies. Venom reactions. Venom reaction. So those are the things we can find. Most of the we diagnose it is not a big difference. Lately means last 10-15 years, I'm seeing more of a chronic hives. This is a big problem.
So chronic hives, it's something that's always there or keeps coming back.
Yes. So anytime we say chronic hives means more than 6 weeks. If the hives keeps on coming every day, more than 6 weeks, we call as a chronic hives. And there is in-between hives. Acute hives, more than 16 weeks, there is in-between hives. Most of the in-between hives are infection-induced. Like you get an infection and you release the same chemical, whether it is an allergy or infection or whatever it is, autoimmunity, you release the same chemicals.
Same symptoms, but one stays with you for weeks, the other it's gone.
Months, years
Months.
sometimes.
What are the triggers to the chronic hives? It's not peanuts.
It is not. That is what I have to find out. Then I tell patients that most of the time we don't know the cause for chronic hives. We call it as idiopathic. So we don't know. So I have some theories about that. You see what I mean? Why we are seeing all of a sudden last 10-15 years a lot more hives patients than before.
Do we know why?
Yeah, we know, because in that slide I showed you, the IgE antibody, it is only comes with allergies. With allergy, like a peanut allergy, like a cat allergy, dog allergy. But there are some people who make an IgE to a virus.
So we've talked about this before. When you talk about things like peanut allergies, when we were kids, nobody had a peanut allergy in our schools. Nobody had to worry about bringing peanut butter to school, but it's such a common thing now. You can't get peanuts on the airplane. You can't bring peanut treats to school. Is it that are we less immune and become more susceptible to allergies? Have we evolved?
Yeah, any of these reactions are not immunodeficiency. They're all your immune system is overreacting, always overreacting.
Oh, we overreact.
Overreacting. So if it's an allergy, you make a specific Ig antibody. Why the peanut allergy is more common nowadays? Because there is a theory that we are not introducing the peanuts very early in their life. So like several years ago, there was recommendations, if you are prone for, your family is more prone for allergies, avoid these 5-6 foods until late.
Yep.
Like peanut, egg, milk. I think that is wrong thing that the doctors recommended. So stay away. Now we went back, introduce them as soon as you can.
I always thought so. I thought that was dumb. Withhold the peanuts, eggs, whatever, dairy, until the child is 3, 4, 5, and that would prevent the allergies. But the opposite is true.
Yes. Now we are introducing when they are 5-6 months old, 5-6 months. But for a while we are trying to avoid them. That's one thing. The second thing is also this cleanliness theory, very clean. So there's a probiotic, the probiotic that stays in your gut. There's say that, that we are becoming more cleaning in everything, cleaning the hands 10 times.
Clorox wipes, we've become addicted to those.
Yeah, there's too clean.
We're too clean.
So because we're not sharing the food, so olden days your mom used to feed you with your hands. So they're giving her, basically they are giving her, flora, the gut flora to you, to the baby. So that's the one theory. And the other theory is people with eczema, for example, they have more prone for food allergies, because food, if you introduce it by mouth, it has a protection. But if you touch the skin, eczema, the skin is broken. So if you touch the food and touch the skin, the food is absorbed to the skin. That sensitizes.
No kidding.
Yes.
So I think about this, but people that lived in the 20s and 30s, no refrigerator, the things were, everything was dirty. People,
they don't have allergies.
So inflammation could be hives, is inflammation, if you have inflammation, swelling or whatever, is that a bad thing, or is that your body treating the bad thing?
So inflammation is a normal phenomenon. But in this case, you get inflammation is too much. But inflammation in what organs? If it is in the skin, we call as hives. But if sometimes I see patients, the lip swells up, throat swells up. It's angioedema.
And they can stop breathing.
Yeah, you can throat swelling.
So chronic hives, 6, 8 weeks, 10 months, it can last and last. How do you treat that then? Because
we don't know what brings the chemicals out, we just block the chemicals. So histamine, for example. Histamine open up the blood vessels. So we give antihistamines. And histamine works in two places, H1 and H2. H1 blockers are the antihistamines. H2 blockers, they produce the acid. So that the patient asks me, why you are giving me acid reflux medicine like a Pepsid for my hives? Well, it's the same histamine that causes the acid in the stomach, can also cause hives. So that's we give that one. Then we give some leukotriene blocker, and everything else doesn't work. We still give those steroids because they're good anti-inflammatory agents.
So you're treating essentially the symptoms of hives.
You're absolutely right. If you cannot find the cause. If you find the cause, we avoid that one.
With allergies, you're able to do all kinds of testing with someone to determine what their allergies might be. Is there a process with hives?
Yeah, because we try to trigger. If it's an allergy, you have that marker, the IgE antibody that's fixed to the mast cells. We put a little drop of peanut and prick it, it will show a small hive there. So that is the testing, food testing basically.
Now, are you personally allergic to anything?
Not me, my grandkids are.
I was curious, what was your interest that got you into being an allergist?
Well, not in those days, then I want to do a fellowship. I don't want to do general pediatrics. So in that field, most of the outpatient is the allergy immunology. Very interesting. In those days, immunology was not that developed. Now everything is immunology. It's a cells, and cell products. So that is really interesting because I think I'm an immunologist. I'm immunology. Allergy is a part of the immunology.
Yeah, you're both allergist, immunologist.
Yeah.
And the science has evolved a lot since you graduated.
Immunology. We used to give allergy injections. We used to call it immunotherapy, but nobody caught that word. Allergy injections is more popular. But now immunotherapy is used for cancers. It is used for autoimmunity. You use it for a lot of things. Allergies also.
The miracle of healthcare. And if anyone has questions or concerns or issues, particularly with hives or any of the other things we talked about, Dr. Dandamudi would be happy to see you. Thanks for coming in.
Thank you. Bye.
From Asthma Allergy Centers, Dr. Giri Dandamudi.